Every day we focus on the daily COVID-19 case counts in the province, but is it helpful to know these numbers? One doctor says given Omicron's low impact on the vaccinated population, we should stop focusing on daily COVID-19 case counts and instead use more relevant metrics.
At the worst of the height of the Delta wave, I'd see 60 COVID pneumonias a shift, and that's a horrifying number of COVID pneumonias. Now I'll see 3, and it's ticked up to about 4.
Radiologist Dr. David Jacobs has been busy analyzing chest x-rays throughout the pandemic. He says the outcome for patients who have Omicron is a lot less severe than for patients during the Delta wave. Keep in mind, over 90% of eligible Ontarians 12 and older have at least 1 dose of the vaccine now, and 88% have 2 shots.
If you've been double vaccinated and boosted, or just even double vaccinated, although I strongly recommend getting boosted, we're not seeing the pneumonias in these patients.
Dr. Jacobs says currently we are seeing an explosion of cases due to Omicron's contagious nature, but those who are vaccinated are doing relatively okay. At the height of the Delta wave, there were 900 Ontarians in the ICU. Today, there are 176 due to COVID. Jacobs says these are the numbers we should focus on.
What is the relevance of case numbers? Well, if case numbers have a high conversion rate to hospitalization, or even more importantly, ICU capacity, then case numbers are relevant. But right now, we're not seeing that.
Jacobs adds, when it comes to ICU capacity, we need to be aware of both bed and staffing availability.
As Omicron spreads, we know that more and more of our ICU staff are going to end up catching it and being put into quarantine. And that, I think, is going to be the bigger bottleneck for ICU. But given what we're seeing right now, I think we're in a pretty safe position.
But epidemiologist Aljaishi thinks the case count is still relevant. He tweeted this today: many underestimate the impact of cases. People often don't realize cases eat up resources like ER capacity, isolation, and impact on mental health, economic costs like lost wages, and importantly, you might feel like hell for a few days, and there's potential for long COVID. We reached out for a comment, and here's what he added in part: I also worry that people often undermine the effects a case has on our society. Each case is associated with economic wages lost, the potential living with long COVID symptoms, and the need for people in their household to isolate for 10 days. These effects should not be taken lightly, given the anxiety COVID-19 causes for a lot of people. Dr. Jacobs says the reason ICUs are doing okay is because people are vaccinated. He adds any of the nasty pneumonia COVID-19 cases he has seen are almost exclusively in unvaccinated patients. For City News, I'm Maleeha Sheikh.